And as we said, she's chiropractor to the stars as well. One of those stars would be Scott Campsall, I believe. Scott Campsall from Wakami Kai joins us along with Shawna Dingman. Good morning.
Good morning.
Good morning.
You're going to have to change your sign now. Although not just the stars, it's to everybody.
Yes. Well, yes.
Yes. How are you? How are you doing?
I'm great. Yeah. Actually, it's just such a beautiful day out today, and the temperature's a little bit cooler. And I slept in, so I am feeling awesome today. How about you guys?
Yeah, well, the sleeping thing never happens for me, so I have to pass on that one. I'm actually wondering how Scott's doing because the dojo's back open again.
Yeah.
Yes.
Yesterday was her first day. Shauna was in class. So hopefully that's part of why she's feeling good.
Yeah, well, let me ask you, Shauna, how was it? How normal was it? How abnormal was it?
It was fantastic. It's about as normal as anything is right now. I was really impressed with the protocols. Temperature's taken when you come in, everybody's masked. Shan Scott has the whole dojo all worked out so that everybody's space is very clearly marked. They're very clear about everything that has to be done. But class is class. We, as students, we are allowed to take our masks off during the actual class, and everybody is completely social distance. So it was a fantastic class, and it's just so nice to be seeing people not on a screen anymore and to be watching three-dimensional movement again.
How about for you, Scott? How was it teaching? Did you find that you had to pull back at all, or you were a little hesitant in making any moves or teaching as you normally would?
Well, honestly, it feels really good for Shauna to give you feedback because you don't get a lot of that. Like, they come in, they do their class, they leave. And we have to do that because we have like a 15-minute window in between classes to clean stuff up and bring students in and out. And so there's not a lot of communication like where normally students would have hung around, talk to you for a little bit and everything. And I've had a very short conversations, but everybody's really respectful of the other students. And so it was really good to hear that. And but as far as this is a whole new thing for me. There's even learning how to teach with a mask on, and it's like it sounds like it's sort of like where people are talking about trying to grab oxygen or in order to work out and stuff like that. I don't find that that's an issue. I'm thinking more along the lines of I've lost half of my face as far as a facial expression. So you can't tell if I'm smiling. You can't tell and when I've pretty much consider myself to be a pretty animated teacher, so that's going to be a factor. And even just we brought the kids in, and they all have, to be honest, at the beginning of the class, the best behaved kids you've ever seen because they walk in, they have their area where they're supposed to train, they don't move. They stay there, where normally they would have been running around. They would, no, they come in, they get ready for their class, and it looks like a bunch of little soldiers. There's, just so good as far as the discipline and like again, I'm sure that things will relax a little bit as we progress and we start learning how to do stuff. But to answer your question, long answer, but yeah, it's going to take a little bit of a learning curve on our end. But I think we're this is the new normal for a bit, so we'll try to overcome it.
Let's continue talking about kids. Shauna, you want to talk about proper posture for kids. Let me throw this out to you. My first question about kids is, and I can remember, sit up straight, whatever. Is there a point where, that is so important because it becomes a learned habit and people end up with bad posture?
Absolutely. And, I think what really sparked this as a topic for right now is I've seen probably half a dozen kids in the last, 2 weeks or so as new patients whose parents have brought them in because they've got sore necks or sore backs, their spines are sore. And it's not really much of a surprise when we consider what's been going on the last 4+ months where honestly kids they've had way too much time to just binge Netflix and play video games and be on their phones. And so the problem is it's really playing out now. It's interesting, I've been a chiropractor for 20 years, and I see things in kids' spines now that we never saw even 10 years ago. And I think it's a combination of the advent of the smartphone generation in combination with that's come at the expense of, you don't see kids out playing road hockey anymore, or, going out and playing manhunt at night and things like that. We used to see kids on the streets all evening, and we just don't see that anymore. And it does come at a really heavy price, because posture has a direct effect on the amount of pain that a child is going to experience. And typically children, they shouldn't have any kind of chronic pain, but now they do. And what we know is that kids who experience pain are much more likely to become adults who experience chronic pain, and therefore have a lower quality of life. Because
they tend, I would think, that they've lived with it, so that just kind of part of their normal. Now, is it apathy? Is it? Well, I guess the word apathy wouldn't be the right word, but the lack of use of muscles that just becomes the factor in creating pain.
Yeah, that's exactly it. So what's happening is, especially with devices, the most common way that kids are using them is they're sitting and their head is slouched way forward, so their head is leaning forward over the device. Therefore, you get all this stress and pressure on the ligaments, the tendons, the connective tissues in the neck, and all the way down the spine, really. And, you talked about, does it become a habit? Well, you get this neural patterning, right? Muscles create neuromuscular patterning with the brain. And so what a muscle is used to doing, it will continue doing. So yes, in a way, it's like a habit. And then what happens is, those muscles that should be strong and healthy, that keep the head upright and keep the shoulders back, they basically atrophy. They don't get enough use. And so therefore you get these front muscles in the front of the body that become stretched and burnt out, and muscles at the back of the body that don't have the strength anymore to hold the head in its normal posture. And it has just a disastrous effect on health in general. But, there's a really interesting study that was done at the University of New Zealand in 2007. And what they did was they took two groups of kids. One, they had them in an upright posture, and the other one, they had them in a very slouched posture, and they had them do a stressful task. And then they noted, first of all, how did they accomplish the task? But then second of all, they had to complete kind of like a subjective questionnaire. How do you feel? Just how do you feel about yourself? So not only was it harder for the kids in the slouch posture to do the stressful task, which makes me think about school, right? Kids eventually have to put their devices down and do homework or sit and study. What it's saying is it's making it harder for them to actually do that task. But what's also interesting is that in their reflection questionnaires, they noted that the kids who were in the upright posture group, they had higher self-esteem, better mood, and less fear. So what's happening is, if we have kids who are in this chronic slouched posture, we are creating a generation of children who are going to be just naturally less resilient, more fearful, sadder, let's just say, lower mood, and have lower self-confidence.
Well, Scott, I'm sure Jennifer could speak to this too, with her clients saying, singing. When you're talking about that, Shawna, it's that blood flow. And if you don't have that blood flow, then you're not thinking properly. It's always an argument I used to use when kids are playing hockey, or even teaching at a college level when we're talking about radio. Well, if you're not sitting up properly, what happens? Well, you crush everything. You're not getting proper blood flow. You're not getting oxygen. Where is it not going? The brain.
Exactly.
It just so happens I happen to have an expert right here. and she can tell you exactly about posture. Hold on.
Well, I'm sure she's always on you saying, come on, Scott, sit up straight.
Well, I'm not touching that. I'm not touching.
Oh, I'm sure she will. Is this Jennifer? Is this Jennifer?
I didn't know I was on, but here I am.
Well, yeah, no, and this is following up on what Shawna was talking about kids slouching and how they are. Obviously, it's going to be big for you. You teach piano and you teach singing as well, and it's a huge part of singing.
Yeah, well, and piano, and I think that there's an element with children where Shawna's talking about less fearful, that there's, just feeling more confident and strong and empowered, whether it's young women or young men. And for singing, the necessity of good posture is, I guess, pretty obvious even to a lay person, to a non-singer. But I think it's equally as important to anybody.
You know, Jennifer, when you're talking about singing, I think one of the great things to note here is that when you're slouched, your breathing is impaired because your shoulders are rolling in, your ribs won't expand properly. And so I'm sure as a vocal teacher, you must talk a lot about diaphragmatic breathing and singing from, as far down in the lungs as possible, right?
Absolutely. And the interesting thing, I teach a lot of young women, and a lot of them who start with me quite young and then go through their teenage years with me. And there's often a time in a young woman's life where they start to slouch forward. When they start to go through puberty and they have this time where they just don't want anybody to look at them.
And start throwing purses over their shoulders.
Purses over their shoulders and everything slouches forward.
Computers.
And so then there's a time where we have to counteract that. And a lot of that just comes from, actually, I think, from an emotional perspective of empowerment, where if you could actually believe in yourself and feel good about yourself, it'll show through your posture, and then that helps the other.
We talk about it with bullying courses. Like when I teach kids anti-bullying and stuff, and we talk about what's a kid who what's his posture like when he looks like a target, and is usually they're slouched over, they look very shy, they look very timid, and then we talk about what's a bully walk around like, and well, he's confident, he's gonna have his back straight, he's gonna look like he's a tough guy, so where with Shawna, you're saying stuff about improved self-esteem, I totally buy that just off of how somebody can carry themselves.
It's fascinating, Shawna, if we could go back to, Jennifer mentioned that there's a certain age, all of a sudden it seems that the posture changes. Now, is that technology? Is that just a natural thing because kids are growing into their bodies?
It's both, but I think what Jennifer is referring to, and I'll just come out and say it, is that when girls start to sprout breasts, they want to hide. So they start to roll in their shoulder. Is that what you're referring to, Jennifer?
Yeah, absolutely.
Yeah, it's this feeling of, oh my goodness, I don't want anybody to see this. And so they do actually, girls especially, will really start slouching in. And then for boys, because boys are often slower to grow, they're behind the girls. When you get a small boy, they have this sort of, I call it small boy syndrome, where they almost want to hide more because they're small. It really shows, and especially in sort of grade 6 or 7, you get some boys that look like men, and then other boys that are, they still look like they're in grade 3 or 4, and they're the ones, they almost make it worse by almost going into their shell. So it's that, hiding posture. And so, yeah, it definitely happens anywhere between grade 5 and grade 7, that's where I really notice it the most. And so I try to speak to it. When they're in my office, I try to speak to it a lot just from an emotional standpoint, building them up, empowering them, just helping them hear it from a different voice that's not their parents, that you let your light shine. This is really important. You got one life, so let's do it.
How much or how big a role, or does it play a role, does social media play?
Oh, it's huge. And I think even as a parent and being aware of it, and a parent who is on social media, I think I still don't quite have a grasp of what it's like to be, I have 3 kids, and my youngest is 12. My oldest will be 21 soon. So I think I still don't really know what it's like to live in their world, because it is so influenced by everything they're seeing. And the reality is that kids they can be the meanest people on the planet. And when they find a weak spot, they'll just, they just dig into it.
How difficult is it to break those habits that may have started?
Well, it really depends on the child and the age of the child. So just going back to a purely sort of physical point of view, when I'm in the office and I check a child, I'm looking at about 13 different tests that I'm doing. Some of them are structural, some of them are obviously chiropractic, some of them are functional, and some of them are neurological, because if the posture is bad enough, it's going to be layered deep enough that it's actually affecting their neurology, their ability to balance, their ability to have strength, things like that. So what I will prescribe to them is obviously chiropractic care. So we get that joint, that specific joint-to-joint movement working properly again. But then I always give everybody very specific spinal supportive exercises to do at home. And the interesting thing is, if a child is young enough, really, they have to kind of do what mom and dad say. So mom and dad will tell them, okay, it's time to do your spinal exercises, and they sort of monitor them and they make them do it. But if a teenager comes in, the first question I always have for the teen is, are you here or is mom making you be here? Because it makes a big difference in how much they're going to recover. I do my part in the office, but they have to, if they want to get full recovery, they have to do their part at home. And for a teenager, and you can't make them do something they really don't want to do. It just becomes a nightmare for both of them. So, if a teen just sort of says, I'm not interested, like I'm really not, then I have a discussion with a parent and just say, here's where we're at. But I actually have found that I would say probably 90% of the teens that I have in my office, they're there for themselves. They want to do it. They're motivated. And when I give them their program of exercises, they follow through really well and they get fantastic results. One of the biggest things that most of them will note is people say I'm taller. People say I look taller, and that's because they're not slouching so much anymore. So, does that answer your question?
Yeah, no, it does. And I'm just wondering, is there a standard at which you're working from, or like many things, individuals are individuals, and posture could differ from one to another person?
Yes, for sure. Depending on what's going on in the spine, some kids have spinal issues that exercises aren't going to 100% take care of. I think there's a genetic component. Some kids have spines that are just more sort of bowed than other people. Some kids have very, very, very flat spines, so they're more likely to look more upright. So there's a certain amount of that. But I would say for the most part, we have protocols, and they're based on chiropractic protocols and rehabilitation protocols, and I've just kind of married both of them. Some of it is just experience. In 20 years of practice, I have a better idea of what works really well now than 15 years ago. I have an idea of how people are going to comply much better now than I would have when I first started practice. So it's a combination of scientific protocols, chiropractic experience, clinical experience, and just dealing with literally thousands of kids over the last 20 years, knowing what's going to work and how things are going to work. But I think there's a certain amount of communication and flexibility. So I try to develop a really good communication relationship with my pediatric patients so that they know they have a voice. They can tell me what's working for them. If something hurts, they can tell me and I can modify it. If they just simply don't like something enough that they're not going to do it, then I figure out, is there a workaround? Is there something else I can give you? And some of it is just, sometimes it's time. If a child is really busy, if they're in all sorts of sports, if they're in all kinds of activities and they're just finding it hard to find the time, then we figure out, okay, how do we pick the most important things right now? What's going to give you the most impact in the shortest amount of time? And how do we cut some things out?
And don't wait. Get on it as early as you can. Listen, as we said, the chiropractor to everyone and the stars as well. Well, listen, we want to thank you for joining us. Some great information there. Scott, good to hear that you're back in the dojo, and great to hear that the kids are so well behaved. I'm sure that it's the master that's the reason that they're so well behaved.
And I think the masks help. We talked about this morning.
Because they're not sure if you're angry.
The masks have brought on an intimidation factor. If I had known...
You'd worn a mask years ago.
Yeah.
Well, listen, we want to thank both of you guys. I think this is a valuable segment that we do every week, and always great information. And Shawna, we thank you again for joining us.
Thanks for having me. I enjoy being here.
Take care. Scott, thanks for joining us again.
Thanks very much, Dan. Sit up straight.
Yeah, the funny thing is, I was just doing this. I thought, I'm slouching. I got to sit up a lot straighter here. Listen, guys, have a great day.
Yeah, you too.
Take care. Bye-bye.
Bye.
Wellness Wednesday, and that's Shawna Dingman again. Her business is in Port Perry. It's called Elevate Women's Health Center in Port Perry, and they are the only chiropractic and functional health care center focused on women, children, and babies. Some great information there this morning.